Hi, welcome to Colin's Corner, and I'm your host, Colin Gregory. And today we'll be focusing on acupuncture. And today I'm at Center Acupuncture, located at 303 5th Avenue, Suite 1415. And with me is my very special guest, owner acupuncturist Dan Poreda. So Dan, what inspired you to be an acupuncturist?
I think it has to do with the fact that I have a history of healers and doctors in my family, so it comes naturally to me. The healing arts, something I've been interested in for a greater portion of my life.
Okay, how many years now?
Well, I've been doing it for 8 years now, approximately. I started studying actually when I was younger, about 14 or 15. I actually studied Reiki, and then I think that's what segued me eventually into pursuing acupuncture.
Now today, as you know, it's so acceptable. It's becoming so acceptable with insurance companies, and you can explain a little bit about that. But mostly, you have like Eastern medicine versus Western medicine, and it used to be like the misconception was acupuncture was only accepted by the Eastern medicine, but now doctors with the Western medicine now are referring a lot of patients for acupuncture, and just name reasons why.
Primarily in Western medicine, acupuncture is used as a pain management modality, and it's very effective for that. There's different reasons why people have pain, so usually you're going to differentiate some conditions where acupuncture would be perhaps the best, most effective, fastest acting modality, some situations where it might be less effective, but usually I'm dealing with pain that has a myofascial component, which means there's usually a muscular component to it. The muscles might be too tight, or there might be an irregularity in the electric impulses through the muscles. And so the needles really, they go directly in, if you're treating pain, right? Needles are going directly into that muscle tissue, and it just has an effect where it has a regulating, resetting effect to the musculature, which a lot of times, even if you have, let's say, a slipped disc in your neck or a structural irregularity, the body's muscles tend to respond and they start to seize up and they start to do these funky things, and that makes pain. And so the needles go in and they reset all of that, and it usually just makes pain go away very fast.
The kind of patients that come in here, you treat them for all kinds of various ailments, right? Yes. I mean, it's like some come in for blood pressure, or acid reflux that even they do now, right? Yeah. Name some some things that's treated.
The largest percent is going to be the range of back and neck and shoulder pain, number one. Also, stress management is huge. Acupuncture has
stress factor. Yes.
I mean, acupuncture basically, even regardless of, I'm going to say, regardless of what treatment you do, if you give a proper acupuncture treatment and you get that, we call it getting chi, which is, it's the response in your body. Usually, you'll feel a response. It's not sharp. It's not a needly sensation, but when you get that response in your body, it has this effect where, in a Western sense, it causes your central nervous system, the pleasure centers in your brain, to release dopamine, serotonin, and some other brain chemicals that make you feel really good. And so, usually sometimes people get up and they actually feel like they're drugged. It doesn't always happen, but and stress is a killer. So yeah, treating stress and the effects of stress is also, that's probably after pain management, that's probably the second most of what I treat. And then following that, allergies is very effective. In the range of pain management, also headaches, migraines, that's a very common one.
Great, you heard it. Come to Center Acupuncture and get on the road to good health.